Good evening, everyone. On behalf of NASH 24 by 7, I extend a warm welcome to our public awareness program on liver disorders, diagnosis, symptoms, and cure. NASH 24 by 7 is committed to delivering high quality educational initiatives and raising awareness among health, healthcare professionals, patients, and caregivers. Today, we are honored to have with us Dr. Saurabh Bansal, sir, DM, DNB, a leading gastroenterologist in Sikandra, Agra, and has an experience of over 12 years in this field. Dr. Saurabh Bansal practices at Shanti Ved Institute of Medical Sciences in Sikandra, Agra. He completed MBBS from UP Rural Institute of Medical Sciences and Research in 2013 and DM Medical Gastroenterology from Topiwala National Medical College and BYL Nair Charitable Hospital in 2022. Sir, we deeply appreciate your commitment to raising awareness about liver health. Without further ado, I invite Dr. Saurabh Bansal to enlighten us on this important topic. Over to you, sir.
Thank you for your appreciation. Good evening to all of you. I am Dr. Saurabh Bansal. I am gastroenterologist in Agra. So today is 19th April. We are celebrating this day as a World Liver Day. And the World Liver Day theme is uh, medicine. So now we start with this. So first of all, some slides about liver. So liver is the second largest organ of human body, and first one is obviously skin. It is weighing about 1500 gram with 5% of fat. If fat is more than 5%, then it is known as fatty liver. It is located in the right upper quadrant, mostly in the right upper quadrant, the abdominal cavity on top of the stomach and intestine. It is pinkish brown in color, soft consistency, and is highly vascular. So now second thing is what is the function of liver? So liver having different type of function, like it destroy the old RBC and new RBC are formed. It processes the nutrients, regulates blood composition, produces bile, produces protein and cholesterol, control 500 metabolic processes, and it breaks down multiples of toxin like alcohol and medicine which we are consuming and detox blood also. Pathogenesis, symptoms, and manifestation of liver disease. So basically, liver disease is divided into two. One is hepatocellular, which affect only the hepatocytes, and second is non-hepatocellular, like which affect the bile duct, vasculature, and metabolic diseases. So non-hepatic liver diseases like cholestatic liver disease, which affect the biliary system. Cholestasis means obstruction of bile flow and accumulation of biles in the hepatocytes. There are least common type primary biliary cholangitis, primary biliary cirrhosis, and sclerosing cholangitis, PBC and PSC. These are both are autoimmune disorder which can lead to cholestatic liver disease. Some drugs can also lead to cholestasis reaction by injury to the biliary tract. Non-hepatocellular liver disease, other one is vascular disease, like if right heart failure, then congestive heart failure, cardiac cirrhosis, and thrombosis in the form of portal vein thrombosis or Berthier syndrome in the portal hepatic vein. Non-hepatocellular liver disease in the form of metabolic liver disease, like hemochromatosis, in which iron metabolism is affected, which leads to excess iron overload in the liver, and Wilson disease, copper retention, copper in the liver. Second is hepatocellular liver disease, direct dysfunction of the hepatocyte, which leads to hepatitis or inflammation of the liver. And different types of hepatitis are there: toxic induced, autoimmune induced, and viral hepatitis. So, toxin in the form of alcohol, which is very common in our setup. Alcoholic hepatitis, which is mainly due to prolonged heavy drinking. First is there is alcoholic fatty liver. Second is alcoholic hepatitis when there is inflammation, then fibrosis, cirrhosis, and then SCC. Second toxin is acetaminophen, which is generally due to overconsumption, metabolized in the liver, which generate highly toxic metabolic intermediates. With overdose, these accumulate and leads to necrosis and acute liver failure. Autoimmune hepatitis generally affect the young woman and in destruction of hepatocyte by body immune system. Viral hepatitis, which is most common cause of liver disease, mainly hepatitis A, B, C, D, E, and some uh, non-hepatic virus like cytomegalovirus, herpes simplex virus, and Epstein-Barr virus. There is another category of virus, hepatitis G, which is recently discovered, which is closely related to hepatitis C. These are the characteristics of different hepatitis virus, A to E. So generally all viruses are RNA virus except except hepatitis B, which is DNA virus. Incubation period of hepatitis A and E is almost 3 to 30 to 40 days, while hepatitis B and D is almost 80 days, and hepatitis C is 50 days. Mode of transmission, hepatitis A and E is due to fecal route, and B, C, D is mainly due to parenteral route. And A and E generally causes acute infection, while B, C, and D can leads to acute or chronic infection. Consequences of chronic hepatocellular injury. So first there is inflammation. Inflammation generally due to chemical release from Kupffer cells, B lymphocyte, T lymphocyte, macrophages, and NK cell. And if this stimuli persistently going on, then it leads to chronic inflammation, which is necrosis, destruction of hepatocyte by cytotoxic T lymphocyte, and NK cells and fibrosis. So, what is fibrosis? Fibrosis is formation of scar tissue in the extracellular matrix. In patients with viral hepatitis, alcoholic liver disease, metabolic, vascular, and brain disease. In all these forms of hepatitis, fibrosis can occur. Cells responsible for formation of scar tissue, mainly a hepatic steroid cell. So, this fibrosis serious harmful effect on function of remaining hepatocyte. Hepatocyte lose microvilli. So, as you can see in the this right lower side, this diagram, this is hepatocyte. And in hepatocyte, there is space of disc. And this space of disc is hepatic stellate cells are there. So, when there is injury is there, this hepatic stellate cell get activated, and this leads to fibrogenesis. Fibrogenesis leads to this collagen fiber deposition, and there is decreased fenestration of the sinusoid, which leads to decreased blood flow to the or oxygen to the hepatocyte. And this is cirrhosis. It is the end stage of disease. End stage of fibrosis, major structural change in the liver parenchyma. One is necrosis of liver parenchyma, nodular regeneration, and changes in the liver structure due to above which compress and distort the blood vessel. As you can see, this is healthy liver on the left side, and on the right side is a nodular irregular margin. It is cirrhotic liver. So cirrhosis, it is progressive disease and may take mm, decades to develop, and if caught in early stage, can regress. Clinical presentation, no symptoms and diagnosis. Diagnose generally in compensated cirrhosis, there is no symptoms and it is diagnosed as incidental finding. Non-specific symptoms such as fatigue and malaise, and major complication ascites, portal hypertension, and fatigue encephalopathy when there is decompensation. So this is very old score. This is also used now. This is Child-Pugh score. It is for assessing of severity and prognosis of liver disease. Five clinical and functional measures are determined. Generally, there are five parameters. One is bilirubin, second is albumin, third is prothrombin time, fourth is ascites, and fifth is encephalopathy. On the basis of this, there is a score of 5 to 15, and we classify this liver disease into three categories: class A, class B, and class C. So 5 to 6 is class A, 7 to 9 is class B, and 10 to 15 is class C. So based on this class, life expectancy and peri-operative mortality can be determined. Hepatocellular carcinoma, it is a primary cancer of the liver and generally due to hepatitis B, C, alcohol, and hemochromatosis. And the basic requirement for this SCC is cirrhosis, which is generally present in 80% of cases. Highly aggressive cancer means survival of less than 1 year, usually in advanced stage when detected, not treatable by surgery, chemotherapy, and not well tolerated. Transplantation can be used for the treatment. These are some signs, symptoms, and clinical complication of liver disease. First is jaundice. So jaundice is almost due to liver disease, yellow discoloration of the skin and sclera, mucous membrane, dark brown urine. Cause hyperbilirubinemia, abnormal range of bilirubin. Portal hypertension, increased portal pressure, compression and distortion of the blood vessel resulting from when there is fibrosis or cirrhosis, there is compression and distortion of the sinusoid, which leads to increased portal pressure. And increased portal pressure leads to esophageal varices, ascites formation, and encephalopathy. Ascites is accumulation of fluid in the abdominal cavity, and the underlying cause is generally due to renin angiotensin RAS activation. For sign of hepatic decompensation, signals of poor prognosis, and hepatic incurve disorder of brain, generally due to this ammonia and neurotoxins diverted to the blood, sorry, to the brain, and it leads to hepatic incurve. Confusion, delirium, coma can occur in later stages. So this is the pictorial diagram of these signs symptoms of chronic liver disease. Neurological in the form of hepatic incurve, skin diseases in the form of jaundice and rash, hematology in the form of thrombocytopenia, pancytopenia, clotting disorder, raised PTINR, enlargement of the spleen, hypersplenism, metabolic in the form of hyponatremia, hyperkalemia, and reduction of serum albumin, cardiovascular fluid retention, ascites, edema, reproductive system and testicular atrophy, gynecomastia and impotence, GI disturbance, anorexia, nausea, vomiting, change in bowel habit, dull abdominal pain, esophageal gastric varices. Liver function test, measurement of element associated with normal function of the liver. So evaluation of liver function in the form of LFT and LFT in the form of AST, ALT, and ratio is very important. When AST, ALT ratio is more than 2, it is alcoholic liver disease, and if it is less than 1, it is viral hepatitis. ALP is also found in liver, brain, bone, and intestine. In liver, mainly in the cells that line the bile canaliculi. Elevation is strongly suggestive for the stresses. GGT is only when alkaline phosphatase is elevated, and we have to decide whether it is due to liver origin or some bone origin. So it is generally hepatobiliary disease marker. LDH, non-specific to liver disease, and later diagnostic value. Bilirubin 2 LFT elevated in elevation indicate impaired liver function as opposed to hepatocellular. cellular. 'Level. 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 Albumin, it is a chronic liver disease marker. Generally, uh, decrease in chronic liver disease or PTINR, it is also chronic liver disease marker. These are the some normal ranges of LFT. Invasive tests in the form of ERCP, generally done for extrahepatic biliary obstruction and percutaneous transhepatic cholangiography, generally not used. Liver biopsy is the gold standard, but it has also drawback in the form of invasive procedure, can lead to bleeding, perforation. So it is generally contraindicated in liver major complications of liver disease and abnormal PT and platelet count. Disadvantage like invasive prone for complication, biliary hemorrhage. So how to keep your liver healthy? So as the slogan is, food is medicine. So if good food is taken, then it is act like a medicine for liver. So almost 50% of the disease will be culminated by having good lifestyle, good food intake. So one is daily exercise, avoid alcohol, smoking, and caffeine. Follow a liver-friendly diet, high fiber diet, drink plenty of water, get enough sleep, and take your vitamins. So, what are the non-pharmacological measurement of liver diseases like hepatitis B? So, generally, hepatitis B is a infected with parental route. So, safe sexual practices, avoid sharing needles, razors, universal vaccination, screening for pregnant women to prevent vertical transmission, that is, mother to child transmission, public health education transmission. Hepatitis C, same route needle exchange program, harm reduction for IV drug user, safe blood transfusion practices, education and awareness to reduce stigma and increase early diagnosis and regular monitoring to prevent progression. NASH, NAFLD, which is the most common disease of liver now. Generally, weight loss through diet and exercise, Mediterranean low carb diet, avoid sugary drinks and high fat food, regular physical activity, and varied exercise. Alcohol, liver disease, total abstinence from the alcohol, behavior therapy and counseling, support group in the form of Alcohol Anonymous, nutritional support for malnutrition, monitoring for recidivism. Like after stoppage of alcohol, patient can be a patient will be again alcohol. Autoimmune hepatitis, avoid hepatotoxic drug and alcohol, regular monitoring and follow-up, and patient education about adherence and long therapy. So this is Mediterranean diet, which is good for liver. As you can see, everyday base meal around vegetable, fruits, whole wheat, grains, olive oil, beans, nuts, legumes, seeds, herbs, and spices. Often twice each week, fish, seafood, weekly moderate portion of poultry, eggs, cheese, and yogurt, and less often red meat and sweets. So two type of exercise, aerobic and resistance. Aerobic exercise reduce the fat, maintain healthy weight, and improve cardiovascular condition. Resistance exercise reduce liver inflammation, improve glucose absorption, insulin sensitivity, and improve metabolic parameter with less energy consumption. For the pharmacological measurement, so on hepatitis B, there is an very potent agent are available in the form of nukes. Hepatitis C directly acting agents are available, which is having high SVR rate. NAFLD, lifestyle modification, risk factor control, drugs, alcoholic liver disease, generally no pharmacological measures are available, only abstinence, nutrition support. Steroid can help in acute hepatitis. anti-addiction drug, autoimmune liver disease in the form of steroid azathioprine, acute hepatitis based on the etiology, portal hypertension like beta blocker, telebacillin, liver fibrosis. There is no such drug available for liver fibrosis. SCC, many new drugs are available, and liver transplant. So key key take-home points are liver disorder have diverse cause and require accurate diagnosis. Early diagnosis is crucial for effective management, preventing complication. Diagnosis involves clinical evaluation, lab test, and imaging. Management include medication, lifestyle changes, which is very important, and also. And lifestyle plays a vital role in prevention and management. So this is all about today's seminar. Thank you. If you have any question, you can ask me.
Thank you, sir, for this enlightening talk. Your insights have been truly valuable. We have some questions coming up. So, sir, with your permission, can we start?
Yeah, yeah, please.
Sir, how
Can I
common
stop? Yes. Yeah.
how how common are muffled and mesh, and what are the risk factors?
Yeah. So, as per Indian data, this is almost in one third of cases, almost 33 to 35% of patients having NASH or NAFLD. Even NASH is 33% and only fatty liver, any MASLD, it is almost 60 to 70%. And risk factor mainly patient having sedentary lifestyle, obesity, high BMI. Yeah.
Okay, sir. Sir, what advice do you have for someone newly diagnosed with fatty liver disease?
Yeah. So first of all, non-pharmacological measures should be there, and we have to cut down the risk factor. If patient is having obesity, we suggest that some weight reduction should be there. If patient having dyslipidemia, so dyslipidemia can be treated with and this exercise, and regular exercise is very important. So, and the patient advised not to take alcohol and any other medicine which can affect the liver.
Okay, sir. So
Yeah.
next question is liver disease curable and what treatment options are available for common liver disorders like fatty liver or hepatitis?
Yeah. So for fatty liver, yeah, fatty liver is completely reversible if patient having weight reduction of 5 to 10% and having regular exercise and like risk factor might like alcohol or any drug which he is taking. So it is completely reversible. And second thing is hepatitis. So based on the etiology, it can be treated like hepatitis B drugs are available, hepatitis C drugs are available. Alcoholic hepatitis generally treated with nutrition and alcohol abstinence. So depending upon the etiology, it is generally treated.
Okay, sir. So next question coming up is does abnormal liver enzyme always mean it is a MASH?
No, it always doesn't mean that if abnormal enzyme is there, then it is generally MASLD. For MASLD is a diagnosis of exclusion. First, we have to rule out some viral infection, which is generally more common, like hepatitis A, E, B, C. Then some autoimmune hepatitis can also lead to development of LFT. And also history is also very important. If someone is taking alcohol, then alcoholic hepatitis can also lead to development of LFT. So yeah, so it is not like if LFT is in, then it is just MASLD. Yeah, NAFLD.
Okay, sir. Sir, that's all from the question part. So now, on behalf of NASH 24 by 7, I extend our heartfelt gratitude to Dr. Saurabh Bansal, sir, for his engaging and informative talk. Sir, your emphasis on liver health and disease awareness has been truly enlightening. It serves as a reminder for the importance of regular checkups and adherence to medications for individuals affected by fatty liver. I also want to express my sincere appreciation to our audience for their active participation and unwavering support, which has contributed to the success of this event. So stay connected with Nash 24 by 7 on Facebook for more updates and information. Remember, your health and the health of your family are paramount. Thank you once again, sir, and to all our participants. Thank you, sir, for joining.
Thank you. Thank you. Good night.